So we're going to be talking about lifting and moving patients today, and what's the big deal? Failure isn't fatal, but failure to change might be. If we're moving and lifting patients or equipment, it shouldn't be fatal to our careers. So how can we move and lift our patients and equipment? How can moving and lifting patients and our equipment lead to our inability to continue working in fire and EMS? Okay, there's actually 3 major factors. Patient's weight. Of course, we get all variances of weight from a patient. Next is repetition. Lifting and moving patients, this is something that we do every single day, day in and day out. We're constantly moving equipment, our big, heavy go bags as well. And also awkward positions. So we would all love that patient to be supine on the floor, ground level, flat surface, and there's nothing around you. But oftentimes that isn't what it is. They might be stuck between a bathtub and a toilet, and we have to get creative.
Wrapped around the toilet.
or wrapped around the toilet. So we also need to be concerned, we're always concerned about the patient, but we have to remember that this is their emergency and we shouldn't be making it ours. So we should always concentrate on how to lift and move a patient properly. And according to the CDC's National Institute for Occupational Safety and Health, in 2014, there were 21,000 EMS injuries and illnesses. Within the injuries, 34% of them were caused by strains and sprains. Of those strains and sprains, 27% happened in the lower back, and over 51% were caused by lifting patients. So that's half of the reason that we get lower back injuries. And when we thinking about the back, so this is our spine, and we have pressure inside of our spinal cords. So when we are lifting a patient poorly, so this is normal, standing straight, pressure is normal. When we bend over in a curved position, we're actually kind of knocking it down, and we're causing a lot more strain and sprain. The pressure inside of our spine is no longer even. So how do we lift patients the right way? We need to understand ergonomics, which is the study of fitting. It's the study of fitting workplace conditions and job requirements to the abilities of the working population. We have to ask 3 questions. What are we capable of doing as EMS workers? What is our job requirements? And then what kind of work environment are we in? And all 3 of these things can vary greatly. So, one aspect of good ergonomics, I have here for you the 8 commandments of lifting. 1, and you also have a handout, and so you can see this on your handout as well. Number 1 is plan your lift and test your loads. When we get on scene, we need to analyze the situation, and part of this is how are we going to remove our patient safely from the scene. 2, ask for help. We always have a partner. We always need to communicate with our partner how we're going to be moving that patient. And we can always call for mutual aid to get extra help. Number 3 is getting a firm footing. Our feet need to be shoulder width apart, and our toes slightly pointed outwards. Number 4, bend your knees. We need to squat, keeping our back straight. Keep your feet in position, and feel as though you are sitting down, not leaning forward or backwards. Number 5 is tighten your stomach muscles. This actually kind of braces our spine, giving us more structure. Number 6, lift with your legs. We don't want any turning or twisting of our back. It's all about lifting with the legs. Number 7, which I will come back to in a little bit, is keeping the load close. This reduces our work effort. And number 8, keep your back upright. Kind of goes along with the other ones. So I wanted to come back to number 7, keeping the load close to you. The physics principle, work equals force applied over distance. So in your second handout, You have stick figure on the left, which I have labeled bad, stick figure on the right. You can see that the load for stick figure on the left, his load is at a greater distance than where he is. So if we pick the patient up like stick figure on the left, we are creating more distance, causing more work when we are applying the physics principle. So to reduce the work, we want to limit our working effort and limit our energy as well. And so we need to pick a patient up like stick figure on the right, keeping that load closer to you. So like when we're picking up the backboard, we want to keep it close to ourselves. So that's it. In the next training, we're going to go over some videos and actually kind of get up and practice our technique. And in the third training, we're going to go out and actually do picking up patients on the gurneys and some other